Hello, my name is Dr. Kedar Patil. I'm a bariatric, robotic, and advanced laparoscopic surgeon at Ruby Hall Clinic, Pune. And in this video, we are going to learn and know what is bariatric surgery. Bariatric and metabolic surgery is a surgery that is done for weight loss and to cure or treat the diseases that are associated with obesity, mainly type 2 diabetes, hypertension, snoring, primary or secondary infertility, fatty liver diseases, hyperuricemia, and cholesterol related issues. Being obese is just not being obese, it invites a lot of diseases which eventually show up. The American Diabetes Association and the Bariatric Surgical Society of India have recommended bariatric surgery as a treatment means to control the weight issue and to treat diabetes. The criteria for surgery are people who have a BMI above 30 with diseases like diabetes, hypertension, joint pain, sleep apnea, or cardiac related issues related to obesity, or a person who has a BMI above 35 without any diseases. The main surgeries that we do as a part of bariatric surgery are into two categories. Either it is a sleeve gastrectomy where the size of the stomach is reduced, or there are bypasses which include a Roux-en-Y gastric bypass or mini gastric bypass or sleeve plus procedures. These are neurohormonal surgeries wherein the hormones in the body get altered, mainly the GLP-1, PYY and the ghrelin levels. That is how a person doesn't feel hungry even if he eats less. Because of this surgery, the basal metabolic rate in the body increases. And due to this combination of neuronal changes and hormonal changes, a person can lose up to 60 to 80% of his excess weight within 1.5 years. Most of the problems that are directly related to obesity, as I mentioned earlier, mainly type 2 diabetes and hypertension, gets cured or controlled in around 50 to 90% of the patients. Person who is on insulin may come down to just medicines, and the person who are on multiple medicines, their sugar can get controlled without medicines. That is an important achievement with this surgery. This surgery is done robotically or laparoscopically. The hospital stay typically is for 3 to 4 days. Patient needs to be prepared a week prior to surgery, and he is on a modified diet for 10 days after surgery. He can resume his duties normally on 7th day after surgery. Most of the issues that we mentioned earlier, the problems get controlled within 7 days. Typically, this effect is seen better in diabetes. The snoring issue or sleep apnea, hypertension, and rest of the issues get cured over the rest of 1 year. Patients are advised to have a regular follow-up 6 times in the first year, twice in the second year, and yearly thereafter. If these patients follow what has been advised, 80 to 88% of the patients do very well in long term. We have now 5-year and 10-year data with Indian patients do well and maintain that lost weight, including remission of diabetes and other diseases. The complications associated with bariatric surgery are less. They are comparable with any other surgery, be it laparoscopic hernia or gallbladder surgery or hysterectomy surgery, because primarily these patients, when we operate, we optimize them very well before surgery. The major complication rate is only 0.3%, and all these patients can have a healthy life after this surgery. There is no hindrance in having a normal life after this surgery. Since the problems associated with the obesity are getting cured, like diabetes, cardiovascular diseases, or hypertension, insurance companies are also covering this bariatric surgeries, and it has been seen that a lot of patients are getting these surgeries approved by insurance companies. The central government health scheme does allow the health scheme patients to have this surgery benefit at no extra cost, and there are ways and means where we can help patients who are not financially affording through charitable organizations or other ways and means to help them to get this surgery done. So, in a nutshell, I can definitely say that bariatric surgery has grown leaps and bounds in India. It is not only a weight loss surgery or it is not only a cosmetic surgery, it reduces 60 to 80% of excess weight, which no other mean can achieve. This weight loss that happens is sustainable in a longer period of time in a larger proportion of patients. Patients need to have a regular compliance and follow up. They need to follow the instructions that the bariatric team is telling them to do. And this is a surgery which is covered under insurance, government schemes, health schemes, because it has advantages in many folds. Thank you for listening to this video. If you like this, please share in your known people and subscribe to the channel. Thank you.